Hi everyone, it's Daniel here from Singapore. Many thanks for the kind invitation to speak.
This is some of the financial disclosure that I have. As we are all aware, mankind has undergone four different industrial revolutions, starting from the steam, followed by the electricity, the computing, and now we are at the AI and deep learning era. AI is actually nothing new, and it was started back in 1950s, and the machine learning term was coined back in 1980s by Arthur Samuels. Basically, it says that the computer should have the ability to learn without being directly being programmed. This was limited by the lack of the GPU resources back then, and the new kids in the block deep learning has sparked tremendous interest in both at the non-medical and the medical domains over the past 10 years. Fast forward to 2020, the world was severely hit by COVID-19 pandemic crisis. And the impact, this has caused a huge impact on the global healthcare landscape, including the need to deploy the healthcare workers to the front lines, and hence resulting in the increased infectious and exposure risk. Within the hospital setting, the patients are experiencing increased waiting time, and some of them unfortunately suffer from the delay of treatment, and which has subsequently caused morbidities and mortalities. And what are some of the roles of AI and digital technologies in the midst of the COVID-19 pandemic crisis? So earlier last year, together with Larry Kareen, Victor Zhao, who's currently the president of National Academy of Medicine, and Professor Tian Wang, we have actually published this paper in Nature Medicine looking at the role of digital technology in COVID-19 pandemic crisis. And the article was also quoted by the CDC as the example articles to share with the world. In the article itself, we describe the use of IoTs, the Internet of Things, the big data, the AI, and blockchain in performing monitoring, surveillance for detection and prevention of COVID-19, which is directly related to COVID-19, the patients, and also the mitigation of impact of COVID-19 patients who doesn't have COVID-19 infection. Some of the examples that we gave in the article included the Johns Hopkins COVID-19 dashboard, the AI for risk modeling in predicting the COVID-19 spread, as well as the medical imaging related CT imaging, for example, for COVID-19 detection. If we talk about deep learning, we really need to know these three big figures. They are jointly called the godfather of AI and deep learning, that who are awarded the Turing Award, which is also the Nobel Prize equivalent for computing. The reference paper I would encourage the audience to read so far has been quoted more than 40,000 times since the day it was published back in 2015. Basically, it says that deep learning allows the data to be analyzed by multiple processing layers with multiple level abstractions. If you break down CNN into three different big parts, it is divided into the input layer, hidden layers, and the output layers. And most of the CNN are different in terms of the hidden layers. AlphaGo and AlphaGo Zero has sparked tremendous interest in the gaming space. The first paper, AlphaGo, was published back in 2016 when the AlphaGo has beaten the world best Go player 3-0 straight match. The same machine was then beaten up by something called AlphaGo Zero using the deep reinforcement learning technique just within 40 days. And the result was published back in 2017, just 1.5 years later. And how is that going to affect what we are doing in the medical space? So the same technique was then applied to predict protein folding and unfolding in the medical domain. And the system itself was then termed the AlphaFold. So AlphaFold 2 result was just recently published earlier this year. And it shows that it has more than 85% accuracy to predict the protein structure, how it folds and how it unfolds. So if you ask a human being to calculate how all the possible configurations, it takes a human 13.8 billion years to do it. And deep learning can potentially make protein structure much faster. And how is that going to affect what we do, medically speaking? Potentially using the same technique, we can develop therapeutic targets for new drugs, or even modify some of the disease prevalence and progression using gene therapy. So this is very, very powerful. If you look at the deep learning applications in medicine, we know we are experiencing a tsunami of the AI papers in different journals for different medical specialties, as well as the target tasks as well. In over the past few years, deep learning has been described to detect lung cancer from CT scan, the ECGs, the skin lesions from the skin photos, as well as the diabetic retinopathy and other retinal conditions from the eye images as well. Within the ophthalmology, we have published a few major AI review articles with many AI players, the major AI players around the world, summarizing some of the up-to-date fundus-based and OCT-based deep learning system in detecting different eye conditions. And we have also recently published another one to look at how AI could coexist with other digital technologies and be deployed at the telemedicine setting. So in the paper itself, we talk about the WHO guidelines for digital health, some of the newer telecommunication network, 5G, 6Gs, the Internet of Things, and some of the new digital innovations on eye conditions, the emerging digital technologies, including the home monitoring devices, AR, VR technologies, and how all these technologies could be applied in the post-COVID-19 new normal setting. And of course, some of the challenges for the clinical implementation and the future directions as well. In Singapore, we have started our AI journey about 6 to 7 years ago in the deep learning space. The first paper we published back in JAMA in 2017, looking at how the deep learning system could be used to detect the three major eye conditions, namely referable diabetic retinopathy, glaucoma suspect, and age-related macular degenerations. So this system was trained based on close to 500,000 of retinal images and the VGG17 network. Following the paper, we have also published another one looking at how the deep learning generated DR gradients could be used to estimate the prevalence and systemic risk factors for diabetic retinopathy. And we also looked at and evaluated the role of AI in helping some of the low to middle income countries to screen for diabetic retinopathy. And in this case, we used the Zambian population as a case example. We have also evaluated the technical and the imaging factors that potentially could influence the deep learning system for diabetic retinopathy that range from the image compression levels, the number of fields, the media clarity, the coding software to build the CNN network and the different CNN networks as well. Lastly, we also evaluated the health economic outcome using AI as a fully autonomous system as well as a semi-automated system in detecting diabetic retinopathy. And I'm pleased to also share that this deep learning system has been included into the Singapore National AI Strategy as well. We have also obtained the Singapore Health Service Authority approval to use this clinically in Singapore. We have also obtained the European CE mark, and we've also spun up the startup company called Iris. And currently, this system has been licensed and accessed to more than 20 countries globally. Earlier this year, we have also described and published another deep learning system in using fundus photos to detect high myopia and myopic macular degenerations. Not only that, we have attempted using blockchain as a new field to improve the AI trust and transparency. So what do we use blockchain for in this study? We have basically used blockchain to regulate the data transfer between the different parties. We have also used the blockchain platform to share the AI models and also the AI testing results. And we have encrypted all this using the hash value as well. I just wanted to spend a few slides to talk about blockchain technology. So what is blockchain? At present, there is a lot of hype in the cryptocurrency space that is on the financial sector. But for blockchain, it is a technology that has powered the cryptocurrency. And cryptocurrency is not the only examples what blockchain can do. So what is really a blockchain really? It is a distributed ledger technology that decentralizes the control to achieve trusted peer-to-peer transactions, and it also bypasses the need for central authority. It usually begins with a genesis block, and the transactions are stored within a fixed size block, and each block will be linked to the previous block to form an endless chain. And blockchain is also termed as the privacy preserving technology because it is immutable. The things that you uh, publish on the platform, it is not changeable, and it can also have a decentralization, the ability, it is secure, and it is also auditable. In the blockchain domain, largely we divide the different technologies into the private blockchain, the consortium blockchain, as well as the public blockchain. So these are some of the blockchain applications within the healthcare space, ranging from EMR, access control and sharing, the IoT monitoring, the research, the genomics, the patient incentive programs, supply chain monitoring, the health certification, which is a very popular use case around the world right now, and of course, the insurance company as well. Our team has also looked at how the fundus photos can be used to detect some of the systemic conditions, including the chronic kidney disease, and the paper was published in the Lancet Digital Health last year. We also looked at how retinal fundus photos can be used as a window to the cardiovascular health and adopting the deep learning technology. And this paper was published in the Nature Biomedical Engineering last year as well. And we have also published another paper in the New England Journal of Medicine last year, looking at how AI could be used to detect some of the potentially life-threatening conditions from the fundus photos as well, to look for papillary edema. And I just wanted to share some of the valley of death that I've observed over the past 5 to 7 years during my AI journey. Right now, we are trying to standardize some of the use of the nomenclature and the reporting guidelines, and to provide some of the clarity to both the medical and technical communities. So there's a Consort AI, Spirit AI's guidelines that were just published last year. Start AI and Decide AI is currently underway. The data privacy and the sharing between the borders, how can we use some of the new AI techniques to do that? Is federated machine learning an answer to it? Is blockchain an answer to it? And what about the generalizability, of one AI system to another? And the last mile implementation is always something that we talk about in the real world setting, the cost of the IT integration, maintenance, and the safety checks, audits, and all these things always come with a cost, a dollar sign. What about the explainability, the XAI? This is another acronym that a lot of people are using. Is the technique mature? How do we explain some of the AI decision, whether in the data driven AI algorithms or the image driven AI algorithms? What about the medical legal implications when something goes wrong within the AI system? Who is responsible and who is answerable to that? What about some of the AI biases and the ethics with the use of the AI, the data from the patients to build the AI algorithms. I just wanted to use this as an example to say that Weiji crisis, the opportunity always follow the danger. And right now we are at the crisis stage, but because of this, I think the world has catalyzed the use of the digital and the AI technology, and the patients, the physicians, and the regulators, providers, and the funders are starting to accept the use of the AI and digital technology within the normal daily life. And with this, I would like to end this with the Sir Winston Churchill the slides. We should never let a good crisis go to waste, and I really can't agree more. And with this, I would like to thank
organizer for the kind invitation to speak and hope to see everyone face to face next year. Thank you.